the information we want to cover is the personal injury secondary treatment considerations for the first few days of care. And this is often overlooked, and so I wanted to kind of do a deep dive of the first few days of care for personal injury, but specifically secondary considerations. So now, when we're looking at secondary considerations, we're going to make a few assumptions here. Number one, we're going to assume the patient is in the inflammatory stage of healing. Number one, always, and remember, there's always a balance between financial drivers, your income potential, and the benefit to the patient. That is a constant balance. And if it skews, too much toward one way or the other, that usually means trouble. So the bottom line is, if you cannot warrant the need for care and document it, it is unnecessary and may be considered fraud, especially if there's a subpoena of your records and they show a trend. So this is the balance as a physician and billing and all that. You want to make the most money possible, but stay within the legal guidelines, number two, but even more importantly, for the benefit of the patient. And when it's any one of those line up that is not for the benefit of the patient, you're in trouble. So you always want to document and keep copies of all your notes and records. And the easy thing that I recommend is voice. I'm often asked, what software do I recommend for notes? And I recommend voice recordings, just like the medical profession does. It's a microcassette recording, and you record it into the microcassette recorder, and then those are transferred out and transcribed. That's how, and by the way, that is the easiest thing you will ever do. When you start taking notes on a voice recorder, it'll be the most thorough notes you take, and they will be the easiest. But for some reason, a lot of doctors have a hard time transferring over to voice recorded notes. And all I suggest is have a template and just have a visual template of what you're going to do and ask, whether it's a SOAP note, whether it's an examination, a re-examination, a history, whatever. You have the template in your exam room, and then just read off the template and then read the results, and then state the results right into the recorder. And that is the fastest, easiest way and one of the best ways to keep notes. So having said that, now, the reason you want to keep documents and copies for all your notes and recommendations is for your depositions or trial. If you're doing personal injury, you're going to definitely end up in depositions, and there's a high likelihood you'll end up in a trial. Remember, 95% of civil cases never go to trial. So you could process 20 cases or 30 PI cases and never go to trial, to be honest with you. Might be, even up to 50 or something like that. So trials are very unusual. Now, one thing that will happen, the better you are at understanding and educating your attorney, the more trials you'll head to, because he's going to want to not settle for the pittance of the insurance company once he's been educated by you and he understands how much he can get out of these cases that they're presently settling for peanuts on the dollar. And once he understands that and has trust in you, and this is exactly what happened to me, once my attorney understood that and had trust in my ability to explain and put it all together in front of a jury, he didn't think twice about going to trial, and which was fine with me because I got all his business. And so part of getting all his business was the ability to go to trial and put the case together, which is no big deal if you put the case together in your office. So another reason for the documents and the copies are considered is the standard of care considerations. Remember, everything's based on what's called standard of care. So you can't just do whatever it is you want. Standard of care is a major issue. And then the financial driver considerations. You cannot document. If you cannot document and support, do not perform. And that's that's just going to keep you out of trouble. If you cannot document and support something, I would not be billing. I would not be doing the service and billing for it. That's when you're headed for trouble. And of course, understanding how to document is real important. And we're going to go into that a little bit further here in just a second. So these are some of the considerations. So let's move forward here with the next consideration. So here's the secondary consideration. These are some of the factors that you want to consider doing that will help the case and help the patient. And remember, we're talking about a standard MIST case, minor impact soft tissue injury case. And remember, over 80% of the cases are under 20 miles an hour. So as a chiropractor doing personal injury, you really need to become an expert in MIST cases, minor impact soft tissue injury cases. So now one of them is to take off work for the inflammatory phase or the re-exam. Now this is real important. You want to take the patient off work for the inflammatory phase for at least the inflammatory phase or up unto the first re-exam. Now that's real important. So it's important clinically. But remember, in the inflammatory phase, the patient will irritate. Whatever they do will irritate and exacerbate the problem. And we're trying to clinically control the inflammation. So that's the clinical reasoning behind not having them do their activities, whether it's work or sports or whatever. Now there's the financial driver side of this and the support side. So taking off from work is a financial driver. So you want to be aware of that. Taking somebody off of an activity, and mainly it's an activity of like work, hobbies, especially activities where they have to make money for their income, that's work. And we're talking about the importance of secondary considerations in the beginning of care, and we're factoring, the financial drivers, the benefit of the patient, your reimbursement. They all have to coincide. And so what we're really referring to now is the importance of taking somebody off, taking a personal injury patient off from work or their activity. So this could be, it's not just work. If they have a hobby of doing something also, you're going to want to refrain from that, because that's just not going to look good in a deposition or in court where you're taking them off work and now they're playing softball every night. So the reason you want to take them off work, and first of all, let's apply it to, the clinical reason is in the inflammation phase. The more activity, the more inflammation. So that's the clinical reasoning for the inflammation phase. And then it's a financial driver, taking them off work, and it supports their injury. It doesn't look as good in court when you're saying how this person is injured this way and that way, or in a deposition, and you never recommended taking them off work, and that will come up. So the reason I'm putting emphasis on this is to give you some guidelines and considerations on how to get this done, because it's going to be different for everybody. Now, also remember, this also includes if the injury was weeks or months ago. And because oftentimes we don't see a patient right after an accident, like the day after. Sometimes we do, but not often. So remember, there's different types of inflammation. So you have the acute inflammation, you have the chronic inflammatory process. So this person could have come into your office a month, 2-3 months later, 6 months later, and you go, well, why should I take them off work now when they've been working? Well, because they're in the subacute or chronic inflammatory state. If they're having inflammation and pain, and chances are they are, or they would not be seeing you. So they're going to be, or it could be a re-inflammation. There could be a re-exacerbation. So the acute inflammation, that's easy to understand. It could be chronic inflammatory. In other words, their work, or their activities of daily living, or hobbies, are causing chronic chronic reinflammation, or it could be an exacerbation or reinflammation. Okay, so that's the clinical dialogue reasoning that they would have it, even if they had the accident, 1, 2, or 3 months ago. Now, here's what is real important, is always ask for the bare minimum off. So if they cannot take off, ask to limit the activity. So whether it's work or hobby or activity, whatever it is, ask to limit the activity that's causing the pain or discomfort. And then the activity to restrict is the affected motion. So whatever motion is causing pain and discomfort, that's the activity that you want to restrict. Now, state the activity and limits. State the activity and the limits. So if it's bending, then state bending. Now remember, this is if the person can't take off work. They say they can't. And we're going to do a deep dive into all these scenarios and show you the sequence of why you want to do this. So state the activity and the limits. And what are the amount? It's the amount and frequency and time off. So that's what you want to state, the amount, the frequency, and that might be lifting. It might be, the degree, the poundage of lifting. Don't lift more than 10 pounds. Don't do it more than 3 times or 5 times per hour, and then don't do it for, 3 days. So these are very helpful when you limit an activity. Limit the specific activity, number 1, the motion that causes the pain or discomfort. Number 2 is the weight bearing of the activity, and then the frequency, and then the time. So anytime you limit an activity, those are the considerations that you want to include. Now, anytime you take off for work for an activity, make it short, such as a week to week with reevaluation. So when you take somebody off of work, and so on the first day, generally, I'll say, hey, do you mind if we take you? And I always ask the patient. This is with the patient, in collaboration with the patient. I don't just say, take off work for 30 days, okay? Then, if you're like that, you're going to be losing patients left and right. So I always will collaborate with the patient with what they can or can't do, but I want to make sure, that I get this down and that it's documented. It's very important to have this documented. So anytime you take off for work or an activity, make it short, such as week to week, and then base it on reevaluations. And here's why. If you give a patient an off-work slip for, say, 2 weeks, a lot of times you won't see them again until 2 weeks later and they need another slip. So don't do that. That's one reason. But also, you don't want to go for long periods of time because you won't be able to evaluate their progress. That's why you would never say, I'm going to take them off, or not never, but you wouldn't say, I'm going to take you off for a month. You might ultimately take them off for a month, but it might be week to week because of what I just said. So it'll limit your dropouts, them just taking the note and taking a vacation, so to speak, and not even coming to see you. And also to evaluate their progress, to see if you can get them back to work or increase their activities in the amount or frequency. So that's the evaluating of the progress. So document it. Now this is real important. If they cannot take off work because of the fear of job loss or loss of wages, and you have to ask them. And so I'll say to the patient, and this on the end of day 1, I'll say to them, and it'll sound like this: hey, Mary, do you mind if we can we take you off for 2 or 3 days here in a row just to help decrease the inflammation and the pain as fast as possible? Would that be a problem if we totally took you off work? That's what that would sound like. That's what I'm always going to go for first. Now, if there's any hesitation, and I generally will do like in the first 4 days, we'll take off. out until after the report of findings. Then I will reassess after those first 4 days. I will reassess the situation and see if I need to continue having them off or maybe modify their behavior, allow them to do their work or activities with modifications and make sure those are documented. And we stated the modifications, whether it's the amount or the frequency. And then remember the time period. Don't make your time periods real long. You won't be able to evaluate, and they'll check out on you. So document if they cannot because of fear of job loss. And so you want to ask them if they cannot take off. In other words, if they can't agree to that, then say, is it a problem with maybe fear of job loss or decreased wages? Is that going to be? And you want to include that. That's real important. So when you don't take off somebody from work, that will kind of hurt your case. It'll hurt the patient, and it'll hurt the financial drivers. It'll hurt your case. And by the way, the opposite's not true. The longer you take them off, the better it'll help your case. That's not true also. But not taking them off will be a negative. So you at least want to take them off for the inflammatory phase, the first 72 hours that you're trying to decrease their pain and inflammation, irregardless if it's acute inflammation, chronic inflammation, re-inflammation, or re-exacerbation inflammation, whatever. That's why they're there. So those are then document if they say, yeah, it might be because of job, then state that. Then put in there that you recommended the patient be off, take totally off for, whatever amount of time, for a week. I would never go past a week in getting somebody off. You recommended that they take a week off. The patient stated that they couldn't for fear of job loss, or the patient stated that they could not for loss of wages. See, that's totally okay now. That's not going to hurt the case. Those are real issues, the real people. And so you're still helping the case and not hurting it. Now, so that's the importance of taking time off. So I highly recommend one of the things you do as secondary considerations in the beginning of care is take time, have them take time off. Ask them first, and don't do it for a long period of time. Do it for only the first few days, the inflammatory phase, and then redo it as necessary. So maybe I would take them off for the first 3 days, 4 days, right? And then after the report findings, what I may do is I may modify it depending on where they're at. I may say, let's go back to work, but can we limit your work? Will your work allow you to go back to work with limited restrictions? And that's kind of a classic. And then typically when I do that, I usually like to keep it like that until I do their first reexamination. And so that's kind of a very classic scenario. Totally off work through the first 4 days in the inflammatory phase. And then after the report of findings, day 4, then we'll say, hey, can we just modify your activity? Will your work allow you to work with them? Or because some jobs won't. They'll say, if you have any limited activity, just take time off. And it has to do with many factors. A lot of times it has to do with insurance, that they'll just get reimbursed better if the employee is totally taken off, and it'll go to workers' comp or something like that, as opposed to having them come in. So sometimes it works best for the employer financially just to say, no, just take the whole time off and then come back. So just be aware of that. The main thing there is to communicate with the patient. And then whatever, just because they couldn't, don't not document that. That's a huge mistake if the patient says, no, I can't do that, I got to work. And now you have no documentation that you requested it and no documentation that they said they needed to for their wages. That would be a mistake in documentation. Now, that's the scenario. And then, like I said, when you do, if there are limits the amount, the frequency, and the time period. And then there you are. Very short time periods. I would not go more than 1 week at a time. That's what I would recommend. Even if I knew it was the next re-exam, I'm not going to give it to them. And I'll just give you another hint also. I like to give them the note after. So tell you what, can I give you the note after we reevaluate you? And that's more of a practice management consideration, because I don't want to give them the note and then not show up for care. So a lot of times I'll say, hey, can I give you the note after we've taken this time off, or do you need it now? Many times they will need a copy of it now, so they can send it to their work or take it into work for the justification. But I'd still like to hold it back to make sure. Now, here's another rule. Anytime you take somebody off work, it's almost mandatory that you treat them every day. It's totally stupid clinically, almost not totally, but it doesn't make any common sense for you to take somebody off work and then you not to be treating them. And that'll come up too. That'll hurt you in court. That'll hurt you in a deposition. So if you're taking them off because of the inflammation or whatever, that's the same reason you should be treating them. And I tell the patient the same thing. So we're going to take you off, and by the way, we're going to treat you those same every day that day to help get that back to normal or decrease the inflammation as fast as possible. So they do not, the real injured patients don't want to take time off and not get treated and just sit around. The people who, some of the malingerers will take your note and then they'll, take a nice little vacation and not see you either. So definitely treat them. Anytime you take somebody off from work, for any time period, you make sure you have them come in for care. That just makes common sense, as well as fits into the financial driver category and the support of the case, as well as the clinical findings of helping the patient. They want to be treated every day. They don't want to not be treated. Okay, so having said that, that is, in summary, with work. I like to, on the very first day, ask them if it's okay if we can take them off for a few days to help decrease the pain and inflammation as fast as possible and not irritate it. If they cannot, ask them why. Is it due to fear of loss of job or wages? Document it. Is it possible to put limits or restrictions on you? And then document it, and the amount, frequency, and then the time period. And then typically what I like to do is after, give them a note for a few days, then after the report, say 3 days, 4 days, then I like to modify their behavior, possibly get them back to work. And I'll talk with them, say, hey, do you think you can go back and do your work? That's how I talk. It's not me only. It's work collaborative. Do you think you can do it? Do you want to do it? Can you modify it, whether it's them personally or at work? And then the last bit of this information is make sure you document what you said. So the preference, whatever your preferences are, make sure you document what you preferenced and why. And then if they couldn't do it, then you state in your documentation why they couldn't do it or why it had to be limited as opposed to no work at all. Make sure you document that. That will come up in a deposition, and I can almost guarantee you it'll come up every time. If you don't take them off work in the beginning, and here you are trying to say, how bad their injury is and support their injury, but you didn't take them off from work. That is really going to hurt you and how you look, especially in a jury. So now the next topic is the TENS unit, and these are secondary considerations. You should already be doing what you're going to be doing for primary treatment considerations. These are secondary considerations. So I do recommend that you subscribe a TENS unit. You either give them a TENS unit or subscribe a TENS unit for home care. That's another financial driver, A. And remember, we're looking at 3 factors here. Your income, financial driver, as well as patient care. And everything always centers around patient care. If you cannot substantiate it with patient care, you can never do it. So when they're in pain, that substantiates the need for a TENS unit. So even if it's temporary, even if it's for the inflammatory phase, I'm giving them a TENS unit for home. So either prescribe it, and you want to write it down, you recommend a TENS unit. So either give it to them in your office. If you are not servicing TENS units, I recommend that you do. And you can just check with your local chiropractic supplier on how to do that. It's very easy. And then, and the billing likewise. TENS units are highly repaid. There's large payments for TENS units also. As an example, I think you can buy them for like $60 or $90, and the UCR is up to like $600 in some of these cases. So it's financially lucrative. It's a financial driver, and it helps the patient. It's all based on patient care. So for home care, that's for when they're at home. And so you can see how that corroborates taking them off from care or limiting their work, and then also helping with the pain or inflammation with a TENS unit at home. It all makes sense. Now, I talked about restrictions, giving limiting restrictions as needed, either no activity or limited activity. So we prefer no activity during the inflammation phase. So that's, the first 3 or 4 days. We prefer no activity. So that's what my notes would reflect, that I requested no activity, but the patient said they couldn't for fear of job loss or loss of wages. That's what my notes would reflect. Now, if they can't do no activity, remember limited activity. So just keep those in mind. We talked about those. Now, the next one is the instructions on the use of an ice pack at home. And you should have a sheet of paper that just gives basic instructions on how to use an ice pack. These are financial drivers. They help with the case, they support what you're doing, and it's home care. So I would definitely recommend that. And then the next one is you should have your medical team in place. And this is where they start to come into play. So right out of the box, we like a referral to our medical team member. And I talk about this in a separate video, that this is the number one best medical team member right now is the pain management doctor. To have an agreement with the pain management doctor, then you can send over your patients that day, no later than the next day, and they can immediately be seen by that doctor. And they're not taken out from under care, and they're not altered with their treatment schedule, and they're told to get back. So that's called your team. So this is where your team comes in. So you're benefiting, and the medication, the classic medications are for pain, muscle relaxers, inflammation, or anxiety. Those are the classic medications that are good for the patient, good for the case. Now, again, this is where you have to get away from a chiropractic philosophy, and we're talking about the benefit of the patient. We're talking about the authority and support for the case. So now we're introducing higher authority into the case, which is your MD, medical doctor. And remember, no attorneys like chiropractors who are just lone cowboys. No attorneys like that, because you will not have as many of the financial driver bases covered, number one. And by the way, all of those are financial drivers. When that medical doctor or the pain management guy subscribes pain pills or muscle relaxers or whatever, those are financial drivers, number one, and they are high authority. So that's the reason. And the third reason is it's good patient management. So are pain pills and muscle relaxers and inflammation good during the inflammatory phase? Sure. Are they good throughout the repair phase and the remodel phase? No. So it's all perspective. It's not being a radical in any one category. Radicals don't do well. So this is part of the secondary factors. And then the notes of importance. Include any primary treatment needed or referrals and diagnostics if needed. So if you need an MRI center, remember, this video is only for secondary factors in the beginning of care. What are some of the most common secondary factors? Not primary. So should you still do what you need to do from a primary treatment standpoint? Sure, do whatever it is you do, chiropractic treatment, muscle stim, ultrasound, whatever it is you do. And then same with diagnostics. If you need to order an MRI, order it. If you need a neurology consult, order it. If you need a concussion consult, order it. So, do the necessary primary treatment factors as necessary, whether it's treatment, referrals, or diagnostics. So, in conclusion, I just wanted to remind you of some of these major secondary factors here. In summary, taking them off work, that applies to pretty much anybody that comes in your office because they're in some sort of inflammatory phase. We went into great detail of the note-taking for taking them off, the times, the activities, whether you'd want to restrict your activity and how you would document restricting their activity. The subscription are recommending, even if you don't subscribe or don't, then recommend it and put it in for the TENS unit, recommend it and make sure it's in your notes. And then, of course, why the TENS unit is used to decrease pain for home care. Give limiting instructions as needed or no activity, instructions on the ice packs, and then start with your medical team. These are some of the most important things you can do that are called secondary factors in the first few days of care.